Have you ever had one of those brilliant ideas? Or maybe, worked really hard on some crucial research, and then you find getting it to actually stick, to be used out there. It's just incredibly hard, almost frustratingly difficult sometimes. Well, today we're doing a deep dive into exactly that challenge. We're looking at how patient-reported outcome measures, or PROMs, were integrated into medical oncology clinics. Now, these aren't just surveys. They're tools to really capture what patients themselves are experiencing, symptoms, quality of life, directly from them. And our mission here is to unpack a specific pilot study. It used this framework called i-PARIHS to guide the whole process, which is pretty complex. What can we learn from it? About making valuable innovations actually routine in healthcare.
Well, PROMs are absolutely vital. We know from clinical trials they really improve how patients and clinicians talk to each other, and that leads to real benefits, better quality of life, even improved survival rates, which is remarkable. But taking that from a controlled trial and putting it into a busy, everyday oncology clinic, that's inherently complex. You've got so many levels, different staff needs.
Well,
it's a lot to juggle.
Okay, right. So let's unpack that complexity. This study used the i-PARIHS framework, that stands for Integrated Promoting Action on Research Implementation in Health Services. Bit of a mouthful.
It is.
But essentially, it's like a roadmap, isn't it, for
Yeah.
these big healthcare changes. It breaks down the innovation, the PROMs, the context they land in, the recipients, so the staff, and crucial facilitation.
Exactly. And using that framework really helped them zero in on the real-world problems and also what helps. So barriers, things like, well, staff just not having enough time. That's a classic one. Also, maybe bad experiences with technology before or worries that the new system wouldn't fit their workflow.
Makes sense.
Yeah, and staff also worried, what if my colleagues don't use this? Will I end up doing more work? And anyone who's tried changing anything in a busy workplace can probably relate to those.
Definitely. But there must have been things that helped too. Enablers.
Oh, absolutely. They found strong leadership support was key. Also a culture that was open to learning and, importantly, a real dedication to patient-centered care already existed.
Okay, so here's where it gets really interesting for me. The study puts a huge emphasis on the facilitator.
Yeah.
This sounds like a critical role. What did this person actually do? Like day-to-day on the ground?
Right. The facilitator was central. Often it was someone internal, but they got support from an external expert too. They were very hands-on. Their job was to actively tackle those barriers we just talked about. So running training sessions, yes, but also providing immediate tech support when things went wrong.
Oh, the on-the-spot help.
Exactly. Solving problems right then and there. And using open dialogue, just talking through concerns people had. Honestly, their physical presence in the clinic seemed crucial. It kept the momentum going and let staff actually try out the PROMs, get comfortable with them.
So you have this structured approach, this dedicated hands-on facilitator. What was the impact? Did it actually work? What did the staff think afterwards?
Well, the staff surveys showed some really clear shifts, pretty positive ones. For instance, how useful staff thought PROMs were. That jumped from 46% before up to 72% after implementation.
Wow, that's a big leap.
It is. And their understanding of PROMs, that went from 30% up to 64%. And their skills in actually interpreting the results improved too, from just 14% up to 58%.
Okay, so definite improvements in knowledge, attitude.
Yes, a really positive shift overall in how staff viewed and understood the PROMs.
But, and there's often a but, isn't there? There's this persistent challenge, time. Even with all these improvements, lack of time was still seen as a major barrier by, 60% of nurses and doctors after implementation?
That's right. It shows just how deep-seated some of these challenges are. You can improve attitudes, improve skills, but that fundamental time pressure, it's hard to shift.
So, wrapping this up, what does this all mean for you listening?
Yeah.
I think this deep dive shows a couple of things pretty clearly. First, a framework like i-PARIHS, it's not just a guide. It helps you sort of predict the bumps in the road. And second, that facilitator role. It wasn't just nice to have. It seems like the absolute engine needed to make change happen in the real world.
Absolutely. And while the PROMs definitely became more acceptable, staff knew more. The study rightly points out that those big, persistent barriers, especially time, mean that sustainability is a real question mark. Once that dedicated facilitator steps back, it might be tough to keep it going long-term without ongoing support. Initial success doesn't always equal lasting change.
So here's a final thought for you to chew on. If even something like PROMs, which have solid research behind them showing patient benefit, face such big hurdles to become truly routine, what does that tell us about getting any new idea, any innovation to really stick in our busy working lives? And what kind of dedicated support, maybe even permanent support, do you think is actually needed for change that lasts, not just for the first few months?